Hello everyone, I'm Dr. Amit Bhushan Sharma, Associate Director in Unit Head Cardiology, Paras Hospital Gurgaon. Today I'm going to talk to you about some new risk factors which have emerged in the last 6 or 8 weeks of COVID second wave as to who are the patients who are more vulnerable for heart strokes, brain strokes and these clotting tendencies. See, diabetes and hypertension and cholesterol everybody knows. But now we are talking about a new subset of population which is pre-diabetic, which is pre-hypertensive, which has got an abnormal cholesterol levels and which have got a procoagulant, pro-inflammatory stages. That means that these patients are the ones who are necessarily were not diabetic, were not hypertensive, but then thanks to the steroids and thanks to the progression of disease per se, they became fully blown diabetic in no time. Their blood pressure shot through the roof in no time. So blood pressure which was initially in the range of 130 by 85, 135 by 85 suddenly reached to 160 by 100 because of steroids. Sugars which were hovering around 110, 115 fasting suddenly went up to 140, 150 fasting. HbA1c which was always in the range of 6.4, 6.5 borderline suddenly went up to 7.5, 8, 8.5. So these are the populations wherein COVID really hits hard and causes blood clots or causes cardiac arrest. So in such cases, please know your numbers, know your sugar levels. If you are a borderline diabetic, make sure that even if you are starting your steroid, tell your physician, tell your cardiologist, tell your diabetologist, and at the same time he will modify or start taking anti-sugar medicines. If you are borderline hypertensive and previously you were not taking any blood pressure medicines, now is the time to take blood pressure medicines because you cannot let it go uncontrolled. We have seen cardiac arrest in young 31, 32, 35 years old patients who were not having these traditional risk factors but still ended up having a cardiac arrest and ending up having a cardiac attack. Right now I'm in the cath lab. We've had a young patient who we've just done an angioplasty, and this young patient was not a smoker, had a borderline hypertension disease, but now when I check his blood pressure is 170 by 100. It is day second week of COVID, which is very classical textbook description. After second week, between 2 weeks to 5 weeks, 6 weeks is the time when the patient starts feeling better. Patient says that I'm okay now, my saturation is coming up, but this is the time when the stroke happens, the brain stroke or the heart stroke happens. Another risk factor which I would bring to light is dark circle around the eyes, dark circle in the skin folds, let us say very dark circles below the breast, dark circles in your armpits, dark circles behind in your elbows, dark circles around your shins. So these are dark circles along with warts or skin moles which are there on the neck. So if you have all these, this is also called as acanthosis nigricans. This is a sign of insulin resistance. This is a sign of a pre-diabetic who can have multiple complications. So this is another thing which you should be looking. If you have any of these risk factors, get your CRPs done, get your D-dimers done, and as a prophylactic measure, not only start aspirin, blood thinners, but also start anticoagulants, the newer anticoagulants which are Eliquis or Rivaroxaban, which your cardiologist will tell you. Thank you so much.